يعطيكم العافية شباب. هاي آخر محاضرة عن Physiology of Parturition and Lactation. Parturition is a process by which the fetus membranes and the placenta are expelled from the uterus. It's also called labor. Initiation of labor at the end of about 40 weeks of gestation, uterine contractions begin. Initially, they are weak and painless. We call it Braxton Hicks. Then the intermittent contractions become painful and increase in frequency, duration, and force, and the cervix dilates. From the beginning of painful contractions of the uterus to the full dilatation of the cervix is the first stage of labor. At this time, the membranes rupture and amniotic fluid is expelled. It lasts for about 16 hours. Second stage of labor. This stage begins with complete dilatation of the cervix. The fetus gradually passes down the dilatation canal by merging of uterus, cervix, and vagina as a single broad channel. Finally, the fetus is delivered. Voluntary contraction of the abdominal muscles and diaphragm assist in delivery. Third stage of labor, the expulsion of the placenta, which follows a few minutes after the delivery of fetus. Followed by delivery, there is beginning of uterine contractions. Increased uterine excitability near term by, first, progressive hormonal changes that cause increased excitability of the uterine musculature. Second, progressive mechanical changes. Hormonal factors that increase uterine contraction. First, increased ratio of estrogen to progesterone. Progesterone inhibits while estrogen increases uterine contractility during pregnancy. Estrogen to progesterone ratio increases sufficiently toward the end of pregnancy. Second, oxytocin causes contraction of the uterus. The uterine muscle increases its oxytocin receptors during the later few months of pregnancy. The rate of oxytocin secretion by the neurohypophysis is considerably increased at the time of labor. Stretching of the uterine cervix can cause a hypothalamic neurogenic reflex. Mechanical factors that increase uterine contractions. Stretch of the uterine musculature. Stretching smooth muscle organs increases their contractility, like twins are born on average 19 days earlier than a single child. Second, stretch or irritation of the cervix. The obstetrician frequently induces labor by rupturing the membranes so that the head of the baby stretches the cervix more forcefully than usual. Stretching of nerves in the cervix initiate reflexes to the body of the uterus. Myogenic transmission of signals from the cervix to the body of the uterus. Onset of labor, a positive feedback mechanism for its initiation. Braxton Hicks contractions, periodic episodes of weak and slow rhythmical contractions during most of the months of pregnancy, become progressively stronger toward the end of pregnancy. Labor contractions, the strong contraction that result in final parturitions. Positive feedback theory of labor. There are two types of positive feedback: increase uterine contractions during labor. Stretching the cervix causes the entire body of the uterus to contract, and this contraction stretches the cervix more because of the downward descent of the baby's head. Cervical stretching causes the pituitary gland to secrete oxytocin, which increases the uterine contractions. False labor. Labor contractions fade away. When contractions fail to re-excite the uterus sufficiently, the positive feedback declines and the labor contractions fade away. Abdominal muscle contractions during labor. Pain signals originate both from the uterus and from the birth canal, elicit neurogenic reflexes, the spinal cord to the abdominal muscles, causing intense contraction of these muscles. The abdominal contractions add greatly to the force that causes expulsion of the baby. Mechanics of parturitions. Each uterine contraction tends to force the baby downward toward the cervix. Labor contractions begin at the top of the uterine fundus and spread down over the body of the uterus. Intensity of contraction is greatly in the top and body of the uterus, but weak in the lower segment of the uterus adjacent to the cervix. Contractions frequency. Early labor, once every 30 minutes, eventually once every 1 to 3 minutes. Contractions of labor occur intermittently to avoid stopping blood flow through the placenta. Separation and delivery of the placenta. For 10 to 45 minutes after birth of the baby, the uterus continues to contract to a smaller and smaller size. This shears and separates the placenta from the walls of the uterus. Placental separation opens the placental sinuses and causes bleeding, but limited to an average of 350 milliliters by the following mechanism. First, the smooth muscle fibers of the uterine musculature are arranged in figures of 8 in English around the blood vessels. As the vessels pass through the uterine wall, so contractions of the uterus after delivery of the baby constricts the vessels that had previously supplied blood to the placenta. Second, vasoconstrictor prostaglandins formed at the placental separation site. Labor pains. Cramping pain in early labor, probably caused mainly by hypoxia of the uterine muscle resulting from compression of the blood vessels in the uterus by activation the hypogastric nerves. Later on, when the fetus is being expelled through the birth canal, pain becomes much more severe, caused by cervical stretching, perineal stretching, and stretching or tearing of structures in the vaginal canal itself. Involution of the uterus after parturition. During the first 4 to 5 weeks after parturition, the uterus involutes, decreases in weight, suppression of pituitary gonadotropin and ovarian hormone secretion during the first few months of lactation. Placental site on the endometrial cervix autolysis, causing a vaginal discharge known as lochia. first bloody and then becomes serous. The endometrial surface becomes reepithelialized. Lactation. Lactation is the process by which milk is synthesized and secreted from the mammary glands of the postpartum female's breast in response to an infant sucking at the nipples. Breast milk provides ideal nutrition and passive immunity for the infant, encourages mild uterine contractions to return the uterus to its pre-pregnancy size, and induces a substantial metabolic increase in the mother consuming the fat reserves stored during pregnancy. Development of the breast begin to develop at puberty, but it's only during pregnancy that the development of glandular tissue is complete and has the ability to produce milk. Development is stimulated by the estrogens of the monthly female sexual cycle. Estrogens stimulate growth of the breast, mammary glands, plus the deposition of fat to give the breast mass. Hormonal regulation of lactation. There are 4 other hormones are important for growth of the ductal system. First, growth hormone. Second, prolactin. Third, the adrenal glucocorticoids, and fourth, insulin. Progesterone is required for full development of the lobular system. Prolactin promotes lactation. Prolactin secreted by the mother's anterior pituitary gland. Blood prolactin concentration rises steadily from the 5th week of gestation until birth of the baby. Estrogen and progesterone inhibit the actual secretion of milk. Placenta secretes large quantities of human chorionic somatomotropin. Colostrum, a form of milk produced by the mammary glands of mammals in late pregnancy and the first few days after parturition. It contains antibodies to protect the newborn against disease, as well as being lower in fat and higher protein than ordinary milk. It has some laxative effect. Immediate after birth, secretion of both estrogen and progesterone from the placenta decreases, which allows the lactogenic effect of prolactin. Each time the mother nurses her baby, nervous signals from the nipples to the hypothalamus cause an intermittent 10 to 20-fold surge in prolactin secretion that lasts for about 1 hour. Prolactin and oxytocin. Oxytocin is concerned with the releasing or ejection of milk, while prolactin is concerned with synthesis and production of milk. Ovarian cycles in nursing mother. In most nursing mothers, the ovarian cycles and ovulation does not resume until a few weeks after cessation of nursing. The reason: the same nervous signals from the breast to the hypothalamus that cause prolactin secretion inhibit secretion of gonadotropin releasing hormone by the hypothalamus, thus suppressing formation of the LH and FSH. Inhibition of milk ejection. Psychogenic factors or even generalized sympathetic nervous system stimulation throughout the mother's body can inhibit oxytocin secretion and subsequently depress milk ejection. Many mothers must have an undisturbed period of adjustment after childbirth if they are to be successful in nursing their babies. Composition of milk. Water forms 87%, total dry solids 13%, and dry solids include lactose, proteins, minerals, vitamins, salts. Humans milk مقابل cow's milk. Human milk has a higher content of water and lactose, but a lower content of protein compared to cow's milk. Certain vitamins and minerals that are necessary for a human development may be lacking in cow's milk. Cow's milk lacks some of the key immunological components that are required by the human infant, and the foreign proteins may trigger allergic reactions in some babies. In babies and breast milk can be replaced or supplemented by cow's milk should be avoided. Appropriate milk supplements developed for infants. شكرا، يعطيكم العافية، كل عام وأنتم بخير، أرجو لكم التوفيق جميعا إن شاء الله.